And I call the Wright County Health and Human Service Board of October 12th, 2020 to order. Please stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, liberty and justice for all.
Okay, first item on the agenda here is the minutes. Any questions, corrections? If not, I'll look for a motion.
I will move the minutes, Mr. Chair.
I'll second it.
Motion by Commissioner Houston, second by Commissioner Betch. Any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next item is the review and approval of the agenda. Is there any additions or corrections to the agenda we should be aware of?
No, only under the consent agenda. You have on your desk the late edition, the SOW. when it comes to the consent
Okay.
agenda.
Mr. Chair, I'll make a motion to approve today's agenda as presented.
I'll second that.
Motion made by Commissioner Vetch, second by Commissioner Houston. Any discussion? Hearing none. All those in favor say aye.
Aye.
Aye. Opposed? Motion carries. Next item, consent agenda. Anything that anybody wish to pull for further discussion from the consent agenda?
I will move approval of the consent agenda.
I will second that.
Okay, a motion by Commissioner Houston, second by Commissioner Vetch to approve the consent agenda as presented. Any discussion?
Only that the first two items will be presented to the chair, and I believe they have an email to him for a DocuSign signature. We're trying to figure out the whole DocuSign process.
Okay.
And the signing of anything, Sarah's going to help me make sure we get that done.
Will exclusively have the one signature because we can't accommodate multiple signatures.
Correct,
Okay.
understood. Okay, any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carried.
Thank you.
Next item, Employee of the Month.
Yay.
Yes, I would like, and I believe we have our employee of the month, Valerie, should be appearing on our screen. Her initials, Val, can you turn on your camera so the commissioners can see you?
I believe I turned it on.
There she is.
Aye. Hello.
Hello.
Hi, Val. So commissioners, our employee of the month for November 2020 is Valerie Stoll. Valerie started at Wright County Public Health in 2016, working with the Child and Teen Checkup Program and Family Home Visiting. Last year, Valerie moved to a new role, working with families involved in the Evidence-Based Home Visiting and Healthy Family America program. So if you recall, we had a new position, and she moved from her existing position into that new position. The nominator states, Valerie was an outstanding Child and Teen Checkups Program coordinator. Since she left that position, she's been cheerfully willing to assist and train all the people who are new to the program. Families have had seamless access to Child and Teen Checkups program benefits. Valerie has a cheerful and approachable demeanor and is always ready to help no matter what she is working on when you have a question. She is very professional and cares about the quality of the work she does. I've never heard her complain about anything, and she is generous with her smile and her laughter, which is a beautiful statement. That's very nice. She's a pleasure to work with, so thank you, Valerie, and congratulations on being our HHS November Employee of the Month. And I don't know if you can see me, I just wanted to add, and then if you have a few words, Valerie, you're welcome, that it's always nice when we move somebody into a new position, and then because we get the benefit of having an experienced person in that position, but not only that, but she's able to go back and kind of mentor over the folks that are taking her old position. And Child and Teen Checkup is a long-standing, very important program area. So we're very helpful to have that expertise in-house. Thank you, Val.
Yeah. Thank you very much for being an outstanding employee.
You have a speech for us?
Did not have a speech. I'm so sorry.
No, but she didn't tell you you're supposed to
We'll
write
let
a
you wait a
speech?
few minutes
Shame on you,
and then
Jamie.
you come back and give us a speech.
Okay.
Congratulations, Valerie.
Thank you
Oh,
so
Mark's
much.
got
Thank
something
you.
to say. He's kind of quiet, though.
Yeah.
Oh, okay.
You may have to turn up your mic.
Muffled through the mustache and
Yeah.
beard.
You can't, okay.
Okay. Okay.
What, you can't hear me, Mike?
Now we can.
My hearing aid isn't in. Wait a minute, I don't have a hearing aid.
I'm sorry. I'm bringing some batteries tomorrow.
Okay, I got the batteries, now I gotta get the hearing aids. Okay, Okay, moving on, regular agenda, social services, public health, financial services, school COVID update. Sarah?
Oh, I'm so sorry to go back. So
Okay.
we thought it was about time that we came back to the HHS board and just kind of let you know what the status was and where things are at. As you know, since the last time we've met as a group, school has started, and I think Sarah would like to share some information around the school starting process and what that's been like. I think needless to say, it's been a little bit more work than we anticipated at the time. And as you know, we are involved with multiple school districts, and Sarah will let you know kind of where things are at.
Well,
I'm looking for them.
Give it to the team for laptop.
Yeah, because we knew when the school was starting.
So Sarah, is everything that you sent?
Kind of flying blind.
I could share it.
Yes.
But you're not planning?
I made the spreadsheet nicer. Wasn't that,
Did you not say anything?
the spreadsheet was an attachment that I gave. Didn't I give you an attachment? I can do the, I think James can share it. Unless you want me to join, I can join the team. Anyways. So I wanted to give you, all right. I'm going to turn off my Teams. I'm getting emails about things that I don't think should be blast. I'm getting Teams chats that I don't want on the big screen shared with everybody about actions that my staff are taking. So maybe someone else could share for me. I can email it to you.
So with that being said, does that mean Michelle has to sing us a song?
Oh.
Oh, come on.
So is there a COVID anthem? I think this would be an appropriate time.
We gotta wait till next year when
I'll
she
just
asks for
email
3 or more staff.
Yeah,
That's right.
I'll second the song.
I'll second the song.
Yeah, I'll second it.
Yeah.
Pardon? Sure, want to take a, yeah, we're on YouTube, so quick intermission, you thought,
That's fine.
until we're ready.
So is it next year, it's not gonna be like a musical like it was last time, so next year it'll be like a country theme or more like a rap?
We can unintermit.
Great.
Go ahead.
So it's a schools update as well as a operational period update. So do you mind going to the other spreadsheet I sent you, Christine, first? Sorry. And out of order. So we had another county went through and did a different visualization of the school information. Obviously, right now, all schools are in Wright County other than Dassel-Cocato are open in-person elementary and hybrid for secondary. And then Dassel-Cocato is open in-person for both.
Okay.
About half of their students are in Meeker County, and when the data for school opening is based on a 14-day case rate. And it's a rolling average, so
Right.
a good day drops off and a bad day gets added right now. As you can see, this is a graph from another county made, but it took all of the state data and just, you can see a lot of schools started in this, they could be all in person, and then that is slowly dwindling and the case rates are going up. What we're seeing across the state is an increase in cases in rural Minnesota, and that case rate is growing faster than the metro area. That's also what we're seeing now in Wright County. So as we were getting into the school year, we had some really high numbers. We did some targeted communication on the eastern side of the county where those numbers were coming from, and it really had a good impact. We saw some behavior change, and those case rates came down, and they have been consistently lower than the county average for case rates since that time period. Now, unfortunately, though, we're seeing a very big growth in the western part of the county in cases, and that's driving our school rates now. So we've been working with a couple of those school districts to talk about their communication, really personalize it, because I think there's still a group of people who feel like it's somebody else's issue, and honestly, the behavior is driving whether or not schools can be open. And our goal here is that kids have a safe and healthy education in person if possible, because that's, we know, the best way that kids can learn. So right now, Wright County was at 19.45, give or take. Last Thursday, we expect to be over that threshold, that 20 cases per 10,000 threshold for a 2-week period starting next week, and for the foreseeable future, unless that is able to change. So we're really going to need some behavior change, or we're going to see some changes in learning models. Ultimately, the schools may their learning model changes are driven by what happens in the school community themselves. So if they're really able to control things, but the more transmission we have in the community, the harder it is for the schools.
Right.
So, you want to show that other slide of your other spreadsheet? That'd be great. We do have nurses working with each of our school superintendents and their COVID response team. We also have what's called a regional support team, so they're using a co-op called Resource Training Solutions that facilitates conversations with MDH. They help them with their specific cases. So Johnny in this classroom is positive, what should we do? That's what the regional support team helps with. We do a lot around communication, data, and philosophical things. We let them know what we're seeing in the community, and then we do a lot of information sharing. So if you could try to get us in there. No, I mean, sorry. I guess that's just the size of your screen. Okay. So,
Can the chat be closed, Jim?
yeah, I think that's what we have to do. So the other part that we're working on is, it's really hard to get on top of the cases in the county when it's taking so long for people to get tested. So we're hearing this from our schools. They're having a kiddo go out with symptoms or have an exposure, and it's taking them 5-7 days sometimes to hear back. And then at that point, they're telling a classroom that they have to go on quarantine, and it's already been 7 days. And that's really frustrating for parents. We've had parents who've had high-risk individuals in their home, and they're really wanting to know that information sooner so that they can take appropriate precautions, and they're really feeling frustrated by that. As well as the negative test, because the guidance right now is if a kid, we know that kids get colds, that adults get colds, and the guidance for schools is if a kiddo develops some symptoms and tests negative, especially the less common symptoms. There are now common and less common symptoms in the school guidance. Like a runny nose and a sore throat, that very well could be a common cold. And they can test negative and go back to school if they're feeling better. So we can get kids back in the school much sooner. But if it's taking 7 days for a test result, that's really hard for families. So we did some digging. I've talked to the board before about access to testing. If you look at the state average for testing, and this is cumulative tests over the course of the pandemic, the average right now is about 3,900 tests per 10,000 people across the whole state. And then you can see that most of the large counties are in that 3,000 range. They're close. Hennepin's almost there. Washington's almost there. Ramsey's almost there. If you want to scroll down. I appreciate this. I did. And then you can see that Olmsted's over the threshold. That doesn't surprise me with the Mayo Clinic there.
Got Mayo
Then
Clinic.
you start getting into Wright and Carver counties, and we're 1,200 tests per 10,000 off the state average. That means our people don't have access. Having had to access it personally, and I know other people in this room, yes,
12,000 or 1,200?
1,200.
1,200.
Okay.
1,200 off the average, sorry.
So 3 is the goal.
1,200 off of 10,000.
Right, yeah.
No, 12, so 3,900.
I thought you said
State
12,000.
average, our average is 27.
But out of how many?
Per 10,000 people.
So the goal is 3,000 per 10,000, 3,000 get
I
tested.
don't know if there's necessarily a goal.
A guideline.
I would say, I would like our people to have the same access as the other large
Mm-hmm.
counties. How about that for a goal? There isn't a rate necessarily, but this continues to be an issue. People can't get in, they can't get appointments to get in. This is a real struggle. And especially some of our providers, while great partners, for their own capacity reason, won't test children, which is another barrier for our students. So we're really struggling here with testing access. I have since elevated this to the State Emergency Operations Center. I did that last week after talking to them. And we will be accessing through our CARES fund some additional testing, but it's not going to do community level testing. We've accessed some saliva testing, which will help with outbreaks. It's much more amenable to people to spit in a tube versus getting the nasal swab. And it has a very fast turnaround. We've tried it out. We can purchase that with our CARES Act funds, but there's not enough CARES Act funds to do this. It's really where the state needs help us.
Isn't this situation always going to be in the reactive mode? You're going to have that lapse of time from the time you take the test to the time you get the numbers. It's not going to be instantaneous where people can say, hey, an hour later I know what's going on.
Some of them are.
We would like to get to that point. Some of those tests are less reliable, which is a problem, and we don't have access to them right now. So, but the saliva test, we tried it out. It was, you don't have to leave your house, which is a bonus. If you're not feeling well or you don't want to schlep your kids somewhere.
And you might be,
Huh?
and you might be contagious.
You might be contagious, right? So you're not exposing your medical partners either
Correct.
to having to swab you. So the test will get mailed to you. You spit in a tube, you mail it back. It's all FedEx or UPS overnight. And there are ways that we are going to assist with some of the mail pieces as well.
And that's not subject to the refrigeration issues or anything else that,
Can be frozen.
yeah.
And even though the one that we tried out, the state saliva lab isn't open yet, but the one that we tried out went to New Jersey, the result came back in 24 hours. So that person was looking at 48 hours without having to schedule an appointment. Test was covered, all of that. So it's a great resource, and we're
Gonna do it
pretty
in
excited
Monticello.
having tried it out. It doesn't work for super little kids, we've figured out, but we've got some workarounds, or somebody who maybe has some problems fitting like they've
So the
had.
silver lining in this cloud is what we're going to learn from this pandemic is going to help us, should we have one in the future, things to make it so it's more instantaneous results instead of guessing and then a week or 2 or 3 or 4 later it's like, oh my God, look at this. Well, you knew with the schools when you went back, you knew you're kind of flying blind. You go in there and you see what's happening. Then as the numbers come back, then you have to adjust. Just kind of knew that was going to happen because you go in not knowing what to expect. Yeah, you don't know what to expect, and when the reality hits, then you got to adjust. So,
Sarah, they're doing the saliva test in Monticello now, aren't they? I mean, my friend just had that done. I thought it was Monticello.
I'm not aware of that.
Okay.
They're still doing a nasal. Some are doing a mid-nasal swab, which is more comfortable.
Yeah, no, she had a saliva in her mouth, so. She's going in for surgery, so anyway.
That would be fantastic. The more, we're kind of sharing this resource with as many partners that are interested in it. I also shared that with one of our other contracted partners. We are not in a contract right now with
Right.
was it Centricare?
What?
Was it Centricare?
I
And
thought-
that's the only
she-
testing location in Monticello
Yeah.
for it, so it has to be
Well,
something.
Yeah.
Stellis was doing something, but
Okay, yeah, I didn't ask.
Not in
I didn't ask. She just said, she expected the nasal swab, and they did the saliva, and it was a pretty fast test, and, yep.
yeah, so I'm glad to hear that more people are taking advantage of that.
Mm-hmm.
So, another update, and I just got this information literally right before I drove over for board. And I had a little inkling of it, but I've forgotten some more. Is that there will be some community testing available for a short period. They've been doing them kind of across the state. It's called surge testing, if you've heard about it. They've done St. Joe's. This week they're doing St. Cloud. They have secured a location at the Monticello Armory, and we'll have testing next week. There should be some plan meetings that we'll be attending as part of our community partners. The majority of the work will be run by the National Guard and contracted staffing corporation or business that works with the state on this. We can have some local presence. They offer that if public officials want to visit it, that you just let me know and I'll coordinate with them for your, if you want to see what it looks like, because they'll provide PPE and those pieces. And then we might provide a few staff just to do some readings and be that friendly local presence that helps with how things go when we have the state. Difference if we have a couple of our staff. So that will be available. They're expecting to do 600 tests. They have capacity to do 600 tests a day for those 3 days. So it's from 12 to 6. So I'll make a dent. And we'll be talking to our school partners across the county about knowing that this is a resource. It is, I believe it's a nasal swab. I don't believe that it's saliva. One of the things, though, that we have been pushing for is they are setting up, they've set up 2 so far across the state, semi-permanent saliva labs. Not labs, testing stations. So there's one in Duluth and they're opening one in Winona. I would really like to get one in Wright County, mostly a matter of finding some real estate. So the state would do the lease, and they're of course hindered by CARES Act funds, and as we all know, CARES Act funds come to an end. So I guess my understanding from the state real estate team is that not a lot of landlords across the state are super interested in a 3-month lease, and apparently they're not popular neighbors if you're like at a strip mall. So
I guess I'm trying to understand.
Afterwards or something.
yeah.
Mr. Chair,
Yeah.
because I try to wrap my head around like these pop-up testing facilities and what value really do they bring, because unless you have an immense backlog where you have hundreds of people that just can't get in for days, otherwise you're just opening up for 3 days, it's not really solving anything. I mean, all you're doing, if nothing else, you're encouraging people to travel from an area that's a hotspot to an area that maybe isn't as much of a hotspot to get tested, which seems ridiculous. I guess I'm just really trying to understand where the value is in what they're doing.
I would think the saturation and just looking at what our numbers look like, that we have low saturation of testing.
So I didn't go to the state and ask for a surge testing site. I asked for a semi-permanent saliva site. And I want something that people can go to every day. I feel sick, I can go tomorrow.
Yep.
Right? And they have that accessibility. I think they're struggling with building those, and this is a stopgap until they get those built.
Okay.
But it's not a perfect strategy, I would agree. But when you send an email like this and say, hey, we need some resources, I think we got some surge testing, which was great, but we need to look at I'm going to continue to put some type of semi-permanent resources.
Will they test children?
I don't know the answer to that. I have to check. We haven't had our plan. But let me see what
It's probably 5 or older, probably, which is a lot of them. It's like
many of them are, yeah.
5 and older.
Mr. Chair,
Yes.
couple of questions. First off, they can use the old jail if they want.
Yes, we actually don't think that's a bad idea, especially after people move out of this building. There might be some parking.
Yeah, could be.
Old jail for-
The other thing is, how come Sherburne County has so much more testing than we do?
I think that's an impact of CentraCare and the St. Cloud Hospital. You have to remember that, I think people think of Elk River, but they have a significant portion of their population that is either inside Cloud or goes to St. Cloud.
And let's not forget the hospital of Princeton, that's right.
Yep, and
At
then
the
they
edge
have
of Sherburne
testing
County.
in Elk River.
Well, why don't we have it at Monticello at CentraCare?
They do.
We
They
do,
do, but they only do 15 tests a day.
do they? Only 15.
Very limited.
Oh. Buffalo does many more than that.
Yeah.
We don't even have that much testing on the south side of the county. I mean, if you're down in Howard Lake,
No,
There's
so
nothing.
as you guys
Laconia is
know,
the
the
only
trailer is at Ridgeview Delano Clinic, and that allows for testing. They do testing in the morning. I mean, some of the issues that come up with, and different systems approach this differently, but if you've walked into the Crossroads Clinic where the Alina testing site is, they have a clean side and, I would not say dirty, but a COVID side or illness side of their office in their waiting room. The Delano Ridgeview Clinic has chosen to keep that a quote-unquote clean clinic and they try to keep that in the morning. Those are people who are coming for immunizations, well child, baby checks, those kind of things. And then they let kids with illnesses or ear infections or strep or whatever come in the afternoon. That's some of their processes, and then they have their urgent care. So they try to keep all of the testing outside. They really needed that trailer in order to facilitate that. It was the only way they were willing to do that.
Hey, Mark, you had another question?
No, that was it.
Okay.
Yeah, we don't have a lot of access.
Right, and that's,
And actually, when you go from Delano, the farthest south is, or the next spot is Chaska.
yeah, because Waconia is your next option for down that way.
And they're only testing, I think, people for procedures and stuff at that office.
Yeah, so it's,
No, but where's our hospitalization at it? I mean, that's really the real number on this, is because, I mean, at the end of the day, we're more concerned about livability than we are number of people getting sick. I mean,
Well, I mean, I think I would caution you on that, because what we're seeing as our rates have gone up is we had time over the summer where no one was hospitalized. Our hospitalization went up 9 from the week before, and we're now at 11 deaths. So there are some that were reported since the last time we did our dashboard. We went a couple months without any deaths, and we've had 4 in the past 10 days.
but then how many of them had DNRs? I mean, that's my big question. How many?
Only one of them was, I believe, only 1 or 2 of them were long-term care residents, and I can't tell you if they have
I mean, because it's a big piece though, because if you have a DNR, they may have been able to live, but they didn't intubate them because they had a DNR, you know? I don't know, it's just, what are the real, what is the real,
because if you really dig down to the details, you get into, but certain things you can and can't do, and it's, what's it gonna solve?
I think the treatments have gotten much better. That's what we are seeing, is that people are able to go to the hospital and return home or return to a rehab facility. We're not seeing that early, first of all, the doctors have seen the same illness over and over again now, so they're getting better at knowing what works and what doesn't work. Rather, in the beginning, it was kind of like, we've never seen this before, we don't know what works. I know that they communicate really well with each other.
Oh,
He's here.
Sarah, I was just wondering when October 81st is.
I'm
October
sorry,
81st.
it's supposed to have, thanks.
what's the
I just forgot to delete the one.
do they have any information on recontraction rates?
I believe that they have a couple scientific evidence of 2 that they believe are different strains from Europe. Right now, the guidance is if you've been exposed and have a positive test, that if you had a re-exposure, like in healthcare, you had a re-exposure within a 3-month time period, you don't need to isolate. So they're going with that. There is some immunity for at least a time period, but long-term, we don't know. I mean, we're talking about March, and it's October. When is it?
Yeah. We think it's October, right?
Yeah.
'Cause they haven't put out formal guidelines on recontraction yet then.
No, there is not formal guidelines, and again, I think there's lots of concern about, much like the flu, that there could be mutations or strain changes that are enough to allow some people to be susceptible. There are some theories about how significant the illness is, so if you get away the first time with, mild symptoms, is the second, is that enough antibodies in your system to really fend off a second infection or a second exposure? So there's lots of questions. I know that I've been really interested in the research that the masking and some of the prevention activities are, you get a lower, if you are exposed, hopefully you're getting a smaller dose. That allows your immune response to respond quicker, and then you're having that mild infection where you're not getting hospitalized, maybe you just feel a little.
And hence the wording on your license, your medical license, a license to practice medicine, because we're practicing, we haven't perfected it, we're still practicing.
Well, I don't even have a license, so
But you know, the ones
I'm
that are
just telling you
practicing,
what I read in the research.
we're not, you know, by the time you get a handle on something, it's already off to the next one, but it takes a long time.
Jeez.
You know, you're practicing,
I
we're
think-
just, by gosh, you know, check and see what you can do to mitigate as best you can. I mean,
I think it would be a good time to mention, like, as a management team, and even how I lead my team, is with a great abundance of grace and forgiveness, because we are operating in unprecedented times.
right.
We do not know exactly what's going to happen next. I wish I did. It's a terrible place to lead from. It's very difficult. And I don't envy anybody above me. I don't envy any of your decisions that you have to make. I get to look at this piece of the issue and hopefully provide you with the best information as possible. And yes, there are lots of lingering questions.
And that's the thing, we do the best we can with the information we have. But if you're looking for perfection on the front end, good luck, because that's not gonna happen. In hindsight, 2020, you can always say, well, you should have done this different. Well, at the time we were in the fry pan, we had to make all these other decisions.
And I guess my goal for Wright County is that we have the same access to resources as some of our
Exactly.
And I will be, you know, very interested as we go forward, are people, you know, really being reinfected, or like you said, it's a different strain. So, I mean, if you had the measles, you're not going to get the measles again. If you had the mumps, you don't get the mumps again. All my life I heard, you know, you don't get the same cold twice. I don't know if that's true or not, but there's so many different strains of coronaviruses out there that the likelihood that if you've had it, you know, you're not going to get it again. So, you know, if this continues to mutate, I can see, but would you, you know, I don't know. I'm not making a statement one way or the other. I'm just curious about how this is all going to shake down. And
I think we are too.
That's the mystery.
But Mr. Chair, I mean, my biggest question to this is has it become to the point now where it's a financial deterrent to people to get tested? Because if you get tested, now you're potentially having to sit at home for 3 days on the bench, not working and not getting paid. And so now you're going to go, well, you know, my kid maybe has just a sore throat. I'm not going to take him in and get tested because then I will have to be home for 2 days. And if they are sick, then I'm on the bench for 14 days. So, you know, I just.
That's a risky proposition to take, because if
But
we have
it's
transmission in the
it's a real
school, they're
decision
not
that
gonna have
people
any
are making.
childcare.
I mean, but it's a real decision that people are probably making.
Absolutely.
You know, that they're like, oh, he doesn't have a fever, she doesn't have a fever, they have a sore throat, it could be strep, I'll give them a strep test at home.
allergies
and, you know,
right now.
yeah, or allergies. It could be literally day after day if you're doing the allergy thing.
I-
You could be taking them in to get tested
Yeah.
indefinitely. You know, so that's
Well,
where.
so the guidance is if there's a so my kiddo, I have a kiddo with asthma. It's documented, he had asthma before COVID. We know what the symptoms are, and if that's an existing condition, they don't send them home for that. So as long as it's documented and you have that from a medical provider, it should be okay. It depends, though. I know some of our providers are very cautious. I would also just add, you know, I did a presentation to a school board, and one of the things that struck me the most was something not that I said at all, but one of the high school leaders, it was one of the principals said, he said, you know, if you've ever been part of a school community when they've lost someone, when they've lost a staff member or a student, you know, in a car accident or to suicide, it is devastating. And so I guess from my perspective, we may just have, that's what's on the line sometimes, and that's what they're thinking of, is their staff, the greater school community about losing, you know, a member of their community to the illness, or having somebody be hospitalized. I think those are life-altering events for both that family, but then that greater school community. And so we know that parents are struggling, and that's why I want to get access to testing, because the last thing I want is a cascading event where we end up losing someone in it.
Mr. Chair,
Yeah.
what is the death rate, mortality rate in comparison of COVID to that of influenza? I mean, the mortality rate isn't exponentially different. We test a lot more for this, but I mean, in percentage of people tested to deaths, I mean, I'm just curious.
I don't have that with me today, but I
But
know
it's just,
that
I mean,
it's
that's
been
just one of those
researched
things,
and
like, I
talked about.
mean, you know,
Because
Yeah,
people ask
but-
you that question, you just say,
but we
"Hmm,
have-
well, who?"
I don't think that is an accurate comparison because we have an immunization that's available to the general public, including children, for influenza.
Not all strains in the, so you get a strain and it's kind of a moving target, so it's not,
Yeah.
We have.
Even a vaccination that's not perfect has been shown to reduce the impact of the disease. So you may still get ill, but you're not going to get the type of illness that might set you into the hospital.
Correct.
We don't have anything against COVID.
Hard to quantify it. Yeah, it's tough. It's good numbers to know if you could get it.
Get it, yeah,
You know.
exactly.
Okay, anything else there?
If anybody would like to see that testing event, just let me know via email and I will get something organized.
Thank you.
Sarah, just maybe an FYI for the board that we had a flu, drive-through flu clinic this past week.
Okay.
You got a what?
Actually, it's available to any
Okay.
employee, so as well as yourselves. It's CUNY. It's scheduled through a CUNY and the announcement's on Wright track. So
Charlie, Mark, any questions?
a couple more days left.
What did somebody say to me?
Any questions?
Oh, and Sarah, I came a little late, so I apologize if you already answered this, but I talked to Sarah last week, I think, about, how have we flattened the curve? Remember when this first started, we took all these precautions to flatten the curve, and now all we see is the cumulative thing. And I mean, like our hospitalizations, I think we have flattened the curve, and I think even with the number of cases, per day or per week, but anyway, I guess it's kind of, I don't know if it gets political or what, that they don't show it that way on the news or anything.
So Commissioner Commissioner Hewsom, I actually shared the comment that was brought up in SHAC, that counties wanted to see that information as well, around the flattening of the curve and wanting to see daily versus cumulative pieces, and that I think they were going to take that feedback to MDH. So hopefully that'll be something that they'll change, because it was several county commissioners on there asking for that very same information. So it was very timely. I
Yeah,
called
because-
right after SHAC.
Yeah, because right now I said, I said go back up, but before the thing was we're going to overwhelm the hospitals, we won't have enough beds and all this, and I think we've done pretty good, I think, so, I mean, the people that die, I'm sure they're not going to say that, but, but anyway.
And Mr. Chair, Sarah, I got cut off the last 15 minutes of the meeting, so,
Came up in the last, I think it was towards the end.
Yep,
to say
so I was
any
gonna
other
say-
things that people wanted to bring up, and that was a specific piece
yeah,
that was brought forward.
we had someone doing some construction, and it cut the power, and then I couldn't get back on. Knocked out my internet, so.
We'll have to look for the minutes to see
Yeah,
if they have
I'll
provided
be
any
interested
additional
to
resources.
hear. There are some good questions coming in.
No, and that's it. You just exchange information and try to figure out what's going on.
Yep.
I think, I would hope they would be able to come up with something as far as what that curve looks like now. I don't know if it looks like a curve anymore.
I mean, so what we had last spring, we weren't prepared. Now we've built some hospital capacity. I think, I guess the things that I look at I'm concerned about. I don't want to have a field hospital, right? I'm looking at what's happening in Wisconsin and some of those places. So Wisconsin is very similar population, and they're posting twice as many cases a day as Minnesota, and have built a field hospital. Their systems are getting overwhelmed, and we're not even into flu season. So it's nerve-wracking.
Mark, do you have any questions, any further comments?
Oh, actually, I do have one.
Good. We've been waiting.
When is this going to be over with? Not the meeting, but the COVID stuff.
The day after the election.
You want to bet?
Yeah, I know.
I keep hearing that. I want somebody to bet me on that one.
I won't bet you.
No, I'm not going to bite you. I'm not biting.
It doesn't matter who's president, who gets
I said I'm
elected,
not
it's not gonna
biting.
go away, that's like a
No.
magic date.
Mr. Chair, it'll end because it'll end sooner than later because of pandemic fatigue. And most pandemics die because people just get fatigued out of it, where they just stop the practice and it does what it does. More often than not, that tends to be the case than it is a vaccine that comes, because that's usually the two ways a pandemic ends. Either there becomes fatigue and people become complacent with it, in which case it no longer gets the justification that it needs or warrants, or a vaccine becomes available. It's one of those two. That's how it ends. I mean,
I guess I'm not in agreement with you on that.
but no,
We
it's one
haven't
of those
had
two
that many
ways. That's the only way it
We haven't had
ends.
that many pandemics in the recent, I mean, how many resources were thrown at the Ebola?
Yeah.
And Ebola never made it to a pandemic.
Yep.
I mean, we had
And
a couple
HIV
cases
and
filter into
everything
our
else,
border,
yeah.
but it was never,
H1N1 was, but it wasn't as deadly, right?
Correct.
I mean, we had, I think, far more cases, didn't we, of H1N1 than we have had of,
but we also had a vaccine platform, right? So they just had to modify it.
You've
Very
had
different.
100 years from the last pandemic. What have you been doing all this time?
But, I mean, Mr. Chair, but you agree that the only way pandemics end is either a vaccine or
Right.
people become complacent with it. I mean, those are the only two way it ends. I
Well, it's
mean,
like-
I mean,
but obviously people would prefer we hold out and take precautions till a vaccine, but if the
Some
vaccine
type of
takes
treatment,
5-6 years, odds are it's probably gonna go the other way, because at a certain point, people just,
We are not 5 or 6 years from a
No.
vaccine, thankfully. I wouldn't bet that number to Commissioner Delighted. We are preparing for vaccine shipments as early as December.
yeah.
It's like the flu shot. Flu against what we know. Some new flu strain comes in, that shot's not going to help you.
Right.
20
Well,
years ago, they were going to get an HIV shot, and they said within 10 years, and 20 years later, so you don't have that. You can try all you want, but maybe it'll work, maybe it won't work.
And I think even if people become complacent, it won't be because public health isn't out there at the forefront
Right.
trying to have it not have people. And I think that's the job of public health.
Mhm.
So I think Sarah's maybe having an issue with the statement because that's the antithesis of public health. They don't want people to become complacent.
I'm just saying that those are the two way it ends. That's,
Yep,
you know.
I understand.
Yeah,
Yep.
humans.
Thank you, Sarah.
Thank you.
Next item.
Appreciate all you do.
Proclamation, October 15th is Financial Worker Case Aid. Case Day. Kimberly,
Johnson is going to.
is it song or dance?
Yep, do a song and dance because we don't have a proclamation, so I think.
Yeah, I know, it's
that's
gonna,
what's gonna have to happen.
thank you, I thought maybe I just missed it in my packet,
No,
so,
it's
okay.
not there.
And nobody wants to see me dance or sing, for that
And the
matter.
hardworking people on our third floor don't get us to read a proclamation.
We have something, we have an excerpt from last year's proclamation that absolutely still stands true. So the governor has proclaimed that October 15th, I believe that's Thursday, will be Financial Worker and Case Aid Day. This day primarily affects my area because I have the eligibility specialists in my area. But I'd like to make sure that everybody's aware that we have case aides across the entire agency. So there's case aides all over in Health and Human Services helping us out. It's important to recognize the valuable services county and tribal financial workers and case aides provide for Minnesotans in giving culturally responsive case management and accessible community services with a person-centered focus. I don't think that anything could be more true than that this year. That's what we're all about. So I'd like to request that the board adopt the governor's proclamation for 2020 and make October 15th the case aid and financial work.
I was going to say, it's in your agenda as information, but it's actually an action item.
It's an action
Okay.
item. Yeah,
Mr.
those
Chair,
are
I'll
always
make a
action
motion to make October 15th our Case Aid Financial Workers Day in Wright County.
I will second that.
items. Motion made by Commissioner Betch, second by Commissioner Hewsome.
Thank you, and we'll get you that
Roll
proclamation.
call or just a aye?
No, it's roll call.
Roll call vote. Commissioner Burrell.
Aye.
Commissioner Leiden.
Aye, but you forgot to ask if there's any questions.
No, there's no
Aye.
questions. We're not giving you that opportunity this time. You took too much time last time. Commissioner Betch.
Aye.
Aye.
Aye. Motion carries 5-0. Thank you all.
Can I ask a question now?
Yes, you may.
Kim, I'm just curious if you've noticed an uptake or uptick increase of people needing additional SNAP funds or that sort of stuff, or insurance.
Here comes Kim.
I think, yeah.
Yes, so we have had a pretty significant uptick in our METS cases and our SNAP cases. And that's what we've expected. However, if we want to talk about flattening a curve, that one has flattened now. It went up and now it's come, it's
Oh.
not down to where it was, but
Okay.
it's come back down.
But that would be
So-
anticipated though, right?
I think this is exactly what was
The loss
anticipated.
of employment, I mean, they're talking about a secondary downturn, so I mean, we might get another,
Another bump somewhere down the road, but
right.
But that's exactly what they thought would happen. A lot of people lost their medical insurance, so that spiked up right away. And as they went back to work, it's kind of calming down now. So it's a pretty interesting situation on the third floor as far as just business is not as usual. We're doing things without interviews, we're doing them with phone interviews, just everything has changed and they're
The
just.
traffic, if for nothing else, the traffic has been not eliminated, but much.
Different.
you're right.
Mr. Chair, question, is the state still not allowing us to close cases?
The state is allowing us to close cases in a very small handful.
Because most of them, it has to be at the user's request, was it before, was the only
At the
way you could
user's
close it?
request, if they've moved out of state, if they die.
Yeah, there's really limited, because we're still doing limited in terms of audit at this point still. I'm guessing because we're coming close to that annual deadline, the annual review that is done in December, and that'll be interesting what that'll look like.
That will be very interesting.
Yeah, that will-
However, so that's okay that we're not able to close these cases right now, because once we restart everything, we'll be able to take care of all of that, and once renewals start, that will all come out in the wash. It does, eventually.
Eventually, yeah. It's just we may be keeping people that could be potentially double insured unless these people are diligent enough to say, hey, I'm insured here, please close me, but otherwise if they don't.
This is what I can tell you, though. Our people are very, very caught up when it comes to our METS cases, and they're working on them the day they're coming in.
That's good.
So they're right on those,
Nice.
and, they're calling those people, and our clients actually do report when they get insurance or something like that.
Good.
Typically, they're right on that.
So if these people do get employment and they are offered insurance and they no longer qualify, are we closing them? Or are they allowing them, because it's kind of a weird deal, if you're on it, you're getting, what?
We call them up. We say, do you
Do
have
you ask them to
insurance?
volunteer, you ask them to voluntarily remove themselves?
Absolutely.
Because before, it just automatically, you're off.
Right, it'll send us a message and it'll say, hey, there's something that doesn't jive here. And so we call them up.
Nice.
So that's what we're doing.
Well, good, yeah, it's,
Okay, before you
It's a
sit
different
down,
time.
any other questions of Kimberly? Okay, thank you, Mark. Charlie?
I guess not.
Obviously, the answer is no. Okay, next on, the director's comments.
I will keep it short and sweet. We've talked about all these climbing numbers in different areas. I just wanted to let the board know that our out-of-home placement numbers have gone down for the second consecutive month. So I believe this is July and August. I don't know, is it?
Yeah, you'd have to be
August,
lagging
September?
behind, yeah.
August and September.
You September, right?
Oh,
So that's good.
it is good.
That is good.
They weren't
No, they
Too
were
high
still
before,
dropping in
right,
Indiana,
yeah, so that's-
we were maintaining a good number, but we were happy to see that downward turn.
So, I know we've mentioned this before, Mr. Chair, sorry. But in the out-of-home placement, I mean, are the majority placed with relatives?
So I don't know if I know we're well above the state average as far as placing kids with relatives. I don't know if more than 50% are placed with relatives. I think what I remember is like 45%.
Oh, yeah, I have to.
Yeah, it just seemed like when we were having the meeting with Safe Families, that it seemed like, I recall that at least at that time, so that was last year, but that over half of them were with relatives, but,
Maybe it is, and I know we're well above the state requirement, which is like in the 30%. And we're well above that.
yeah, which is, I mean, that is a positive thing, I think.
And we do a nice job, and maybe Michelle would like to tell you very quickly about the sign that's going to be going up.
Yes, so last year, we had signed.
You might want to come.
Is every opportunity to hear your voice we savor.
We all do, yes.
I'm sure.
She's blushing, look at.
So last year.
I don't.
Last year, we, with some of our foster care recruitment dollars, we had a sign made, and it was hanging out by the rodeo, and so got a fair amount of visibility out there. And it's not out there any longer, and it's been sitting in our building for probably a couple months. Yep.
Doesn't do a lot of good there.
No, but Valerie, our.
Different Valerie than our EOL.
Right, yes, another Valerie, the social service Valerie. She did a bunch of work with Alan, and our sign is now going to be out by the Public Works building. So
good.
on that intersection there, it's going to be kind of, she had to work through like where it could all sit and to
with
get all
the
the
state.
approvals and everything, right. And so I'm not sure the date it will be placed out there, but it should be shortly, and we're looking forward to getting some visibility.
Okay, now, I
Recruitment
got a
there.
question for you. On this out-of-home placement, is there a difference between urban, suburban, ex-urban, rural? Is the percentage pretty consistent? Large county, small county, large city, small city? Those numbers that.
As far as
were up-
kiddos going into care,
Yeah, it's just pretty consistent, or they haven't dug in that deep on?
oh, I don't know.
Yeah.
I mean, I have access to that information.
Yeah.
We have, with SSIS and Tableau, we
They
have
might have it, they
everything.
might not.
I mean, just see, like, we do know that some counties that have smaller populations but more economic hardships, or else potentially if they have some other types of communities within their county do have some higher levels of.
Placements. Right.
The only time I ever heard anything about that is regular population or population versus like reservation, and those kind of issues are way opposite ends of the world here.
Right.
That's the only thing I've ever heard on this.
And I can forward the information. I don't have it. I mean, it's on my computer.
You know,
but
if
I
you
don't
get
have
it-
Population density
It-
necessarily.
it-
that people like-
My question is, if you get such information, could you just put it as an FYI on our next agenda or something, just because, something simple, so you just get it, so you can see it? I mean, it's kind of interesting.
Yeah.
Mark says okay, so that we're good to go.
All right.
Mr. Chair, one last question before we close up. Do we know what the end is on the extra federal SNAP funds? That comes to an end pretty soon, didn't it, or did it already? You don't have a date yet? I was wondering on that, because how far that was going out or not.
Anything else?
No, I'm going to hound you for that signature, as long as Mr. Kelly is here, I will get his as well, and then I'll.
Okay, now I'm gonna get with Sarah after the meeting, get those things signed that need to be signed right now. And on a lighter note, before we adjourn, show of hands. How many noticed that Commissioner Vetch got a haircut?
I did.
Not until you pointed it out, I didn't.
And you say men are insensitive.
Had to cut the gray out, yeah.
Yeah. Yeah.
It
I
only
don't have
worked
to
for
worry
so
about that,
long.
it all falls out. Anyway, we stand adjourned at 2:24.